Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. There are 2 additional deaths related to COVID-19 that we're reporting today. I'd like to extend my condolences to their friends, family, loved ones. The current 5-day COVID-19 test positivity rate is 10.7% provincially and 10.2% in Winnipeg. As of 9:30 a.m. today, 124 new cases are reported. Our case numbers are heading in the right direction. Our vaccination rates are climbing. We continue to see deaths related to this virus. We continue to see that strain on our healthcare system, hospital admissions, especially ICU. Dr. Atwell presented some modeling data last week showing that our numbers are in that moderate projection. So this indicates that the restrictions that have been in place have had that beneficial effect on our case counts. And that's why we've been able to just slowly ease some of those restrictions. But despite those decreases in case numbers, we still see that our hospitalizations and ICU numbers remain high. And we're likely to continue to see that for the couple weeks to come because that's that lagging indicator. In the past several days, we've seen those overall number of people in ICU seems to have stabilized, but it's still at that extremely high number. And again, our data is showing that the vast majority of people being admitted to ICU are unvaccinated. So again, not trying to cast any blame on people. There's lots of reasons why someone may not have been vaccinated as of yet. The point being is showing that benefit to vaccine, that we're not seeing really any Manitobans that are vaccinated and protected being admitted to ICU. So that's that benefit of the vaccine. That's why we want to continue increasing those first and second doses. That's what's going to lead us to that Manitoba summer that we're all expecting. So we need to continue to bring these numbers down. We need to bring the vaccines up, and that's going to help us be in a position to start to reopen. We know that that Delta variant does provide a risk to us. That has the potential to be more transmissible and more severe in its impacts. This means that we have to continue to be cognizant of that Delta variant, continue to follow the fundamentals, and to ensure we're getting vaccinated and getting both doses of vaccine. And this is exactly why our reopening plans are cautious, because we know if Manitobans continue to get vaccinated as soon as possible, if we continue to follow the fundamentals and the public health orders, we're going to be in that position to continue our reopen plans. But if we slow our progress in vaccine, if we see that spike in numbers again, it's going to put our reopen plans in jeopardy. Father's Day is coming up, and so unfortunately, yet again, this is another special occasion. We're not going to be able to celebrate the same as we did prior to the pandemic. So we want to ensure we're protecting our dads, ensure we're following the public health orders, ensure we're getting vaccinated as soon as possible. Gathering indoors is not permitted currently. However, we can gather outdoors on private property. You can have 5 visitors from no more than 2 households, in addition to those who reside at that property. In public outdoor spaces, you can have up to 5 individuals. So again, following these restrictions is a requirement. But again, on top of that, we're suggesting all Manitobans reduce the amount of contacts they have outside their household. So it's up to us to take those steps to protect each other. We want as many people to get vaccinated as soon as possible. If you haven't gotten that first dose yet, please get vaccinated as soon as possible. If you're due for your second dose, do book that as soon as you become eligible. Speaking about first doses, this week, the Leela Super Site, 770 Leela Avenue, will be allowing walk-in appointments for those first dose immunizations. So if you haven't got that first dose yet, You can go online, book your appointment. You can book your appointment, or you can go to that Leela Super site this week, June 15th from 9 a.m. to 3:45 p.m., June 16th, 1 p.m. To 7:45 p.m., and June 17th, 9 a.m. to 3:45 p.m. for a walk-in for your first dose. So please take us up on that opportunity if you haven't got your first dose yet. And this is adding to that collective action. Right? The public health orders are necessary to have in place up to now, but what's going to take us to that Manitoba summer, to those reopening plans, is our collective action, following those orders, but more importantly, getting vaccinated as soon as possible. And so thanks again to all Manitobans, and I'd like to open up to some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from Global News, Brittany.
Good afternoon, Dr. Roussin. Today, Ontario said that they'll be lifting the border restrictions for Manitoba as of Wednesday. What will this mean for Manitobans here who now want to go into Ontario? Will we still have that buffer zone like we had before? Will people need to isolate when they come back to Manitoba?
Yeah, so the only change right now to our travel isolation rules was the one we've already implemented. So if you're fully vaccinated in 2 weeks, you will not need to isolate upon your return. The other restrictions that are related to neighboring communities and people traveling to their own property will remain in place, but we don't have any immediate plans of changing the orders otherwise.
Thank you. And this weekend we saw, for the first time in a while, 7 deaths in one day. Is this just, lagging hospitalizations that we've seen before, or are we expecting to see more and more death numbers like this in one day moving forward?
Yeah, and so, obviously we send our condolences to the loved ones there, and we've had this 15, 16 months of reporting. I know, we're not losing sight here, and that these are Manitobans. And so, yes, it was a higher number than what we've seen lately. I think related to just a day-to-day variability that we see, unfortunately. So, we're going to continue to see deaths. This is another lagging indicator. So, with everyone we report is obviously a Manitoban that we've lost, and our condolences go out to them.
From the Brandon Sun, Colin.
Good afternoon, Dr. Roussin. With what Manitoba has learned from the second and third waves of the pandemic, how will you approach things differently if the Delta variant becomes a big concern, or if we're hit with a fourth wave?
Yeah, and so we've continually learned throughout this pandemic, and then we've had to relearn a number of things each time a new variant of concern arises as a dominant strain. So I think what not necessarily a dramatic change. It's just the vaccines have changed our approach to it. So when we're getting on to, nearing that 70% of 12 plus being vaccinated and seeing more and more get that second dose each day, if we start seeing numbers rise again, we need to focus on those that have not yet been vaccinated. So we're going to have to do that more targeted approach and try to reach those that have been, for whatever reason, more difficult to get shots in arms. And so that's really the vaccine velocity early on. It was very important as we face these variants of concerns, and we're seeing that vaccine velocity still at a good rate for us. We're seeing more and more Manitobans get vaccinated. But as we see that start to plateau, we're really going to need to focus on ensuring that we can get true access to all Manitobans to ensure we get more and more of those, their first and second doses, to prevent that substantial fourth wave.
On the subject of vaccine velocity, do you have an idea yet of how helpful the vaccine incentives the government has announced so far have been in encouraging people to get vaccinated?
No, it's too early, certainly objectively, to comment on that. We've heard some anecdotes of people, especially that travel, that's really, whether they were going to get vaccinated or not, but it's really expedited their desire to be vaccinated. So it's more anecdotal now. We'll have to see over time. We really want Manitobans to get vaccinated first and second doses as quick as possible. It's really our way out of this.
From CJOB, Skylar.
Hi, Dr. Roussin. Thanks for your time this afternoon. I know we just announced the reopening path in Manitoba here less than a week ago, and obviously we were a bit slow to the third wave compared to some other areas. When that comes to, the Delta variant, second dose vaccine uptake, and avoiding a fourth wave, does that actually put us in a bit of a position to, where we're better served maybe by having a later third wave and in the fact that we might be able to avoid a fourth wave entirely? Just looking at other areas like the UK that are already starting to slow down some of their reopening plans.
Yeah, I mean, it's tough to say. I think that certainly the goal of delaying any wave here was an important one because when that wave arrived, we had more and more, a greater proportion of Manitobans protected with vaccine. So the longer you can delay that, the more people that are going to be protected. Despite that, we saw quite high numbers and quite severe cases. But it's very likely that if we had lower vaccine rates, that we would have been hit even worse. So, moving forward, I think we're in a position to see some of the effects of other openings throughout our country and internationally. So we'll be watching very closely on what's happening in other areas. So, I think really the key is for us to get as many Manitobans those 2 doses as possible.
Thanks for that. And I know vaccines aren't particularly your purview, but I think you'll be able to answer this question for me. We've heard anecdotally a lot of folks that are booking their second dose appointments maybe 3 or 4 days before they anticipate their actual eligibility will be expanded. But by that point, and by the time they go get their shot, they are eligible, so they end up getting an earlier appointment than they otherwise would have. Does that have a big effect on the vaccine uptake at all? And when we're trying to get those second doses out compared to, in some areas compared to others, when we're talking about an age-based rollout for the most part?
Yeah, so I don't know the precise details on the effect. I think our messaging would be, book that appointment when you become eligible. That would be our suggestion to Manitobans. I think it's, all of the way we structure things. It's we're hoping Manitobans will wait until they're actually eligible to be vaccinated before they book that appointment. So, I think the rollout is going quite well. We're seeing that uptick in second doses quite dramatically now, and we're going to need to put that work in to continue to increase the first dose uptake because that's some of the harder to reach groups. So, I think Manitobans, let's pay attention to the eligibility criteria. As soon as you're eligible, book that appointment. But I think we'd ask to not book your appointment before you're eligible.
From the Winnipeg Sun, Scott.
Hi, good afternoon, Dr. Roussin. Just kind of going back to Brittany's question on self-isolation and cottages. Is that something that could change July 1st in the reopening plan? Could people be able to go to their cottage, during those 2 summer months and not have to self-isolate? Will there be a buffer zone coming back at some point?
Well, right now, if you, own property and we don't specify a specific geographic distance, but if you can visit your property and return without having to isolate. So that's certainly present now. As more and more weeks go by, we think it should become less and less an issue because we want more and more people with that double vaccine and gives them an exemption no matter what anyways. So that's what we're focused on, is that getting as many people double vaccinated and then that's certainly your exemption, but those visiting their own property can return without isolating.
Okay, thanks for that clarification. the CFL announced today that they're returning. I assume that you guys have been briefed on that sort of thing. What kind of rules will be in place for that? Have you, or will you be kind of announcing anything along the lines for that, like kind of how we did for the NHL's return?
So we've been working alongside the CFL and the Bombers here. So we don't have anything specific at this point, but we're looking to have a high vaccine uptake in Manitoba and a real strong Manitoba summer. And so I think that's going to translate into into a CFL season that's going to be successful. So we don't have those specifics. It's a little bit away, but we are working actively on what that's going to look like.
From CBC Manitoba, Sean.
Good afternoon. Can you tell us a little bit more about how you're tracking the Delta variant, maybe specifically how you're sequencing for it, and the kind of sophistication that you're using to look at that variant?
Yeah, and so right now we're certainly screening for the other three variants. We have those in place for quite some time. So, and then we're sending, those that screen as non-specified and other certain higher risk type positives for sequencing. So we're sending that to the National Lab for sequencing on it, and more importantly, right now we're working on a screen. So we want to be able to, in the near future, be able to do that screen for the Delta variant, so we can find those particular cases earlier. As far as the public health approach goes overall, we're treating essentially all cases as if they were a variant of concern, as if they were the Delta variant. So at the actual public health interventions at the case-by-case contact tracing level, it doesn't change what we do. Overall, of course, we want to see the surveillance and see if this is propagating and where. But right now at that individual level, at the contact tracing and case management, we're just treating everyone as if they were a variant concern, including a Delta variant. We're just being that aggressive with case and contact management.
With respect to the border to northwestern Ontario reopening, are there any plans to screen people that are returning that don't have properties? Obviously, the region is a place where a lot of Manitobans go for leisure travel. How can you assure that folks that should be self-isolating if they return over the border are warned to do so?
Yeah, I think this has been a challenge, right? So we're one of the only Western provinces that have that self-isolation requirement upon entry into Manitoba, with some exceptions. Enforcing it is that challenge. Certainly, it can be picked up on at various levels, but a lot of it requires, based largely on most of our public health orders, is adherence from Manitobans. And so more and more Manitobans are receiving that second shot. So more and more will just be automatically exempted from that. But right now we're still discouraging that non-essential travel. But with the vaccine uptake coming, we're looking hopefully in the near future to have less and less of these restrictions.
From the Canadian Press, Steve.
Hi, Dr. Roussin. The test positivity rate continues to drop. It's still at 10%. What number would you like to see it come down to before you further loosen any restrictions?
Yeah, so we're not going to necessarily rely solely on that. So it's certainly an important factor, but it's there may be circumstances where that test positivity is higher or lower than what we expected, and might still go forward with our plans. The sort of the ballpark of that 5% is what's typically out there, but it does we don't look at just one indicator. We're looking at that strain on healthcare system as well, overall cases and things. So we definitely want to see this coming down below the 10% mark, and we're seeing that trend. But I wouldn't say we have a specific backstop on there, but certainly around that 5% is what we're looking for.
And given what's been happening in the United Kingdom, where they were well ahead of us in doses, and now they're seeing with the variant sort of a resurgence, another wave, what do you think that means for Manitoba and for the potential vaccination going forward?
Yeah, it's hard to have these direct comparisons. There's some differences in the vaccine uptake and regimen. We saw that they had access to larger quantities of vaccine, so they had a very early vaccine velocity and got up to fairly good vaccine uptake early on. We're expecting in Manitoba to have better uptake in first and second doses in the near future. And we'll have to just see how that Delta variant propagates here. So we look at a number of jurisdictions. We have that advantage to see what's going on in other areas, but we expect that vaccine uptake to really climb here in Manitoba, and we're expecting to have a good Manitoba summer.
From CTV Winnipeg, Michael.
Hi, Dr. Roussin. On the topic of second doses, we're approaching our July 1st first dose target, but we're still a ways away from the second dose target. And some folks are saying it's going to be weeks 3 or 4 as they book their second dose appointments. So I'm wondering, can we actually reach that target right now? Is it already in jeopardy given the slow rate of second doses and administering second doses?
No, we're on target to meet that on time, and so the second doses are being administered rapidly. You're seeing a rapid growth in that percentage uptake over time. So certainly when people are booking, their second dose is out a number of weeks, but that's because of the demand. And that's so doses are going out the door. So we're going to meet that demand before or that target before July 1.
Okay, and on test positivity, the provincial test positivity is now higher than what's in Winnipeg. I'm wondering if that trend continues, and let's say we hit that 5% benchmark in Winnipeg well before the province as a whole. Could we see restrictions loosened in the city of Winnipeg before the rest of the province?
Well, these are the kind of things I'm mentioning, is that we don't just look at one indicator. So there's a number of scenarios that could put us in that position. Like you say, the large urban center may have a decreasing test positivity. We may see a dramatic trend. We may see a very significant decrease in hospitalization. So there's a number of things that we're following. So there just isn't that one indicator that we would deal with.
From CHVN, Taylor.
Hi, good afternoon. Back to the CFL. When will fans in Manitoba get an idea of what games could look like?
Yeah, I hope in the near future we're going to have a bit more insight into that. I don't think we've definitely worked out things on the specifics, but like I say, I expect this to be a good Manitoba summer. I expect that as vaccines increase, the public health restrictions are going to decrease, and you saw that set out in our plan. And so hoping to have some more specifics on that, but I'm optimistic about that season.
Thanks. And today we saw much lower new case numbers than we're used to. Is this an anomaly or is it a trend? Do you think we are getting closer to being 100 cases a day?
Well, I think the trend is certainly going in the right direction. You always have to be cautious about, individual daily numbers. Sometimes can relate to test volume and other things. So we'll have to follow it over. But certainly each day that goes by with lower numbers, it's what we're after. It's what we're predicting. But we can't make much of a single daily total.
Our final reporter this afternoon from the Winnipeg Free Press, Katie.
Good afternoon, Dr. Roussin. Because we don't yet have a screening test for the Delta variant, how does that affect Manitoba's ability to track health outcomes in people who are infected with that variant?
So, the severe outcomes, people who are admitted to hospital, ICU, these are the ones that are sent for sequencing. So we're going to know whether we're seeing that severe outcomes related to Delta variant. So we are, screening for many. We're sending many for sequencing. So we'll be able to track that. Of course, we want to do it in more real time, and that's why the people at a lab are working on being able to screen. But we'll overall have a good sense of that.
Okay. As of this morning, there were 26 patients being treated in Ontario and Alberta in ICUs there. Is Manitoba planning to keep transporting patients out of province for the foreseeable future?
Well, this is going to be largely the clinical issue. It's really we have to ensure that we're able to have ICU available for COVID and non-COVID clients. We have to ensure our healthcare system is there and ready for COVID and non-COVID patients. So, it really depends on that, on the demand. As these case numbers are declining, we're going to anticipate declining numbers in hospitalization and ICU. Of course, that can lag. And so, the clinicians and shared health are managing that bed situation as best they can. And, if transfers are necessary, then they're taking that opportunity.
Thank you, Doctor. Thank you, everyone. This concludes our media briefing.
Thanks.